Hello, everyone. I'm Nadia Watson Anthony. Today, I want to begin by acknowledging the importance of self of a therapist when working with sexual concerns. As a therapist, our personal values, beliefs, and lived experiences shape the way we show up in a room. Now, this includes our comfort level discussing sexuality, our cultural upbringing, and the way we understand relationships and intimacy. Being aware of our own assumptions and potential biases is critical because it directly impacts the therapeutic process and the client's sense of safety. When we reflect on our own sexual scripts, comfort, and areas of growth, we strengthen trust, respect, and attunement in the therapeutic relationship. My goal in this presentation is to highlight not only clinical features of FSIAD, but also how therapist self awareness enhance treatment effectiveness. As mentioned earlier, therapist' personal values, beliefs, and experiences shape therapy. Understanding awareness and bias impacts therapeutic effectiveness. And it's very important to build that trust and safety in the client therapeutic relationship. So, how the therapist self influence sexual issues. The therapist's inner world is where I want to start. Listen, when you think about the therapist's inner world, our comfort, discomfort, and emotional responses can either open or limit the conversation. So, what is often happening inside of the counseling room? You see things arise, issues related to discomfort, bias based on personal values, assumptions, moral framework, cultural and religious beliefs, empathy and openness, which helps clients feel validated. And you also see the importance of alignment, meaning we remain non judgment and collaborative. So being able to recognize these influences and allows us to create that healing space and being unintentional about reinforcing shame, which is very, very important. So, what is FSIAD? Well, female sexual interest arousal disorder, or what we would say FSIAD. And this is defined in the DSM 5 as persistent reduction or absence of sexual interest or arousal. The symptoms must be present for at least 6 months, cause significant distress, and cannot be better explained by another medical or psychological condition. This will include reduced sex thoughts, sexual thoughts, decreased initiation or responsiveness to sexual cues, and reduced pleasure or sensation during sexual activities. So, when you think about FSIAD, it is multifaceted and often influenced by biological, psychological, um, relational, and different types of social factors. And we're not going to be able to go through all that today, but when I was doing my research, I found out that it affects 10 to 15% of women. And that it doesn't seem like it's a lot, but it is. So distress, when you think about distress, what kind of stress is causing the relation this particular topic of discussion is causing stress within the relationships, but what are the underlying factors, which is what we're going to discover here today, which brings me into the core symptoms. So when we're talking about the core symptoms of FSIAD, the core symptoms include reduced or absent sexual desires, as we said before, decreased sexual arousal, fewer sexual thoughts or fantasies, limited responses to sexual cues, reduced pleasure or sensation. Now, these symptoms are not signs of personal failure. They're often reflected. reflect underlying emotional, relational, and medical influences, which that is something that I want to dig further into to help normalize the situation because people a lot of times think that hey, I'm just jacked up. But the truth is there could be some medical underlining things happening where as a therapist, I need to collaborate with other professionals in order to help my client get the necessities in the time of this time in their life. So let's move forward with personal and personality factors. Well, some personal traits correlate with sexual desires and arousal patterns, and these include um, introversion, openness to experiences, linked to flexibility and curiosity with sexuality, insecure attachment styles. This may influence safety, intimacy, and I think it's vulnerability and body image, which is a huge one and what I see all the time. The body image concerns which can reduce people think that is it's higher. No, it reduces self-confidence and body acceptance. And these factors help us to understand the client's inner world and the emotional patterns around their sexuality or the sexuality. When we think about biological factors contributors to FSIAD can include hormone changes, menopause, postpartum shifts, thyroid dysfunction, diabetes. A lot of I see that in a lot with people that have diabetes, chronic illness, medication side effects, pain conditions such as like pelvic pain, fatigue, chronic stress, which reduces physical arousal, and biological factors highlights the importance of the collaborations with the medical professional, something we discussed in our prior slide. Now, when you think about trust, hopefully we didn't do that. Hopefully I didn't switch that up. But when you think about trust, again, sexual desires does not exist in isolation. Relationship dynamics, and we should know this, dynamics play a major role. And the factors include communication difficulties, right? Conflict of unresolved emotional injuries, low trust or emotional disconnection. And supporting FSIAD requires addressing the relational system, not just because individuals have experience. There are social stressors such as work demands, cultural expectations, again, unbalanced caregiving over household roles, and then the emotional disconnection. So, moving a little fast, but when you think about CBT, cognitive behavior therapy, this approach will help a client identify unhelpful beliefs about themselves, like the body shame and the body image and their sexuality. And when we work with these common themes, such as performance anxiety, negative body thoughts, catastrophizing, shame, this base belief about sexuality, CBT helps support clients in developing new cognitive frames, adapting behaviors that promote sexual satisfaction and confidence. It's like neurogenesis, creating those new brain waves or cells that's in our brain in order to be able to help our clients get where they need to get. And again, we can't do this alone. We have to have a team of people creating those new neurons in the brain. It's very important. So, as for sexual interventions, Um, sex therapy provides structure, evidence-based interventions such as you got desire mapping, behavior assignments tailored to clients and partner, which is very important because there's no one cookie cutter for a relationship. Sex therapy helps individuals and couples come together on individual levels, but also as a couple that are sexually struggling, and provides clients with tools to rebuild that connection and that pleasure that is so needed. First, it's individual, and then it's collaborative, it's collective, it's two couples coming together, working towards the goal of what they want their life to look like. Now, one of my favorite parts is the mindfulness and somatic approaches. Well, when you think about mindfulness, this is something I practice. Mindfulness increases the present moment awareness, and it also helps clients reconnect to their body sensation without judgment. I don't know if you heard of grounding, but we'll talk more about it. Somatic approaches include grounding, breath work, and body based exercises that will restore connection between the mind and the body. And these methods reduce anxiety, promotes relaxation, and enhance the body's natural arousal response. So when you get in your body and you start to speak, because your body speaks to you, it tells you when things are going wrong. But we live in a busy society where we're not spending enough time alone to be able to sit with ourselves, to hear ourselves think, because we're so outwardly focused. And so, as you sit with yourself and you do meditation and you're listening to your body, what happens is you're promoting relaxation and you are enhancing the body's natural arousal response, because your body can connect with the things that are needed. Mm, mm. Just that quick. My body was grounded. I can get back to where I was. Your body speaks to you. You understand what I'm saying, right? So these methods reduce anxiety, it promotes relaxation, and enhance the body's natural arousal responses. Mindfulness is going to increase the present moment awareness, regardless. It can happen if you find you someone who can help teach you these type of skills. I can guarantee you that life can look a little bit different for you. So for some people, it takes years, and it takes a while to get to a place, but even as a beginner, you'll start to see change. Moving forward, when you think about the medical intervention, um, clinicians must collaborate. I mean, there's nothing else to say. I'm done. No, I'm just kidding. But clinicians must collaborate with medical providers. This way to ensure the holistic, safe treatment plan. Because there are some things that as a therapist is beyond our scope of practice, and there's a time when you have to refer out by asking questions, doing your assessments, because there's things that we can't do, like hormone therapy, medication adjustments, treating underlying medical conditions that could be going on with our clients. And medical approaches may look different from each client, but addressing things such as pain in the pelvic floor, the dysfunction or the hormone imbalance that happens, that we hear about all the time. So when you collaborate with a provider, this it will ensure holistic, safe treatment. This is not just one stop shop. Some clients have to have all of us, all clients have to have a collaborative team around them, because there are usually other things going on besides just trauma, right? In the mental health world. So when you think about holistic integration, okay, this is holistic treatment. And for me, myself, personally, I can share a little bit about myself. I am a plant-based vegan. I do not eat all things raw, but I do eat plants. That's what my diet is consist of. And so once I start to eat these plants, my stress reduction, it just went down, and I was amazed. Because of the lifestyle modification, I was able to incorporate this in my life. So as a therapist, I would bring this into my practice, holistic treatment. And it will include like nutrition guidance, stress reduction practices, lifestyle medication, pelvic floor therapy. I became a doula when it went in order to help clients, and complementary treatments such as acupuncture. I don't do that, but I can refer out. And what happens is integrative care acknowledges that the desire is influenced by the whole body mind system, not just a single factor. There are other things going on inside the body that people don't necessarily have the time to sit down to think about. And that's where us as therapists, we come in play to be able to work for our clients' well-being. Now, yeah, holistic good sounds really good, but there are some challenges in treating FSIAD. And they are unique challenges such as stigma and shame around the sexual concern. How many people don't want to see a doctor? How many people don't want to see a therapist? Right? Clients feeling broken or hopeless, like, oh, I'm broken. This, I'll never work. Nothing in my body turns on. And limited partner involvement, meaning they don't love me anymore. So when you think about a medical system that overlook sexual well-being, we have to come together as a community. So therapists has to partner again with the medical providers, psychiatrists, psychologists. All of us have to sit at a table in order to know how to better help our clients. And the stigma and the shame about sexuality is huge with what we see in today's world. But I want to encourage somebody here today. If that is you, don't be ashamed about this. This is a diagnosis. This is in the DSM-5. This can be treated if you will get with someone who can help you figure out the pieces that may be not in the right place. You are normal. As we come to a close today, in summary, FSID is a complex condition. And I chose this because I've been influenced. And when you think about different type of biological, social, cultural factors, effective treatment requires an integrative client-centered approach that will be available, and it will help prioritize safety, education, and empowerment for our clients. And as a therapist, our self-awareness is my self awareness is just as important as our clinical skills. And because our presence directly impacts healing, we must be on Front Street when